Facebook today. They're our premier sponsor for today. And by the way, if you are interested in advertising your business or just want to help sponsor this show, you can send us a message at thekimhammershow.com. And Ben over here will pick up the message. We'll be in touch with you. It is not high price to sponsor the show. That's not what we're about. But if you'd like to get some good exposure, and just to give you an idea of the ratings of the show last week, with regards to State Senator Dr. Scott Jensen out of Minnesota, our views were 21,000 views, over 42,000 pushes, and about 425 shares. So you get some good exposure by advertising on the Kim Hammer Show. If you'd like to do that, just send us a message. We'll take care of you. But our premier sponsor for today, as you notice on the logo, is Everett GMC Buick. A great place to buy a new car or a pre-certified used vehicle and get your service work done. They can take care of you from bumper to bumper, top to bottom. And then for real estate, Baxley, Penfield, Mounty, they're great here in central Arkansas. They're located down there in Sling County at Spring Hill and Highway 5. Call down there and talk to Tom Baxley, one of my friends, or Lance, any of those guys, or Dan Mounty. They'll all take care of you there at Baxley, Penfield, Mounty, whether you want to sell real estate, buy real estate, you want to rent real estate, whether commercial or residential. You have property that you want to rent, but you want to deal with the renters. They've got a division that'll take care of that for you, and they do an excellent job in all your real estate needs. Would remind you tomorrow here at noon on 101.1 FM The Answer, I'll present the sermon that I present to the church I pastor, which is Saline Baptist Church down in the community of Tull. You can hear that tomorrow here at noon on 101.1 FM The Answer, or we're going to do it Facebook Live here in about an hour and 15 minutes. And with that being said, and also glad to see Russ and Zach both on the studio, working on the other side of the window and having been here. If you got questions for the AG or for the congressman that's coming on in the second part of the show, you can send him a message. He's watching our Facebook Live page and our social media. Send in a message, and we'll be glad to get it up before our guest today, which our first guest is our Attorney General, Leslie Rutledge, joining us on the call-in line on the Kim Hammer Show. And Attorney General, thanks for taking a little bit of time to spend with us here on the Kim Hammer Show today.
Well, glad to be on with you, Senator. Happy Saturday to you. What an awesome lineup of advertisers you have. I mean, just all incredible people, incredible businesses. Absolutely love Edwards Food Giant, and couldn't agree with you more about what a great place to get a meal.
And you've got Edwards over there in your neck of the woods, don't you?
We do. So over in East Arkansas,
Yes.
Oh, you bet. So my husband has a farm in Crittenden County,
Yes.
and he's a row crop farmer, and as we've talked about many times, so now's a very busy time for our row crop farmers and farmers in the state as they're having to do more watering than the good Lord isn't picking up his share right now. So we're having to irrigate a little more, but we're working it out with him.
Well, very good. Well, I know you're on limited time today, and I really appreciate you taking time to be with us on the show, because what I want to talk about and focus today, there just seems to be an unusual amount of fraud activity that's going on both here in the state and outside the state. And just the first one I want to talk about is the unemployment insurance fraud scheme that's going on. And Dr. Childress would have been on the radio with us today, but I think she's in Fort Smith tending to some things over there. And I think your office anyway is involved in that. On a personal level, my wife was actually one of the victims of the unemployment fraud, and also she received a couple checks from the Pennsylvania unemployment office for about $8,000 to an address that we lived at over 30 years ago. And yes, we did not cash those checks. But can you tell us about the unemployment insurance and all the frauds that are going on, what you're doing, and what's being done to try to get it stopped and corrected?
Well, thank you, Senator. And yes, unfortunately, we don't have hours and hours to talk about everything that we do at the Attorney General's office with regard to stopping fraud and scams. But we have noticed an uptick throughout this pandemic. With a bad situation comes bad actors. Normally we would receive 200 to 300 phone calls per week at the Attorney General's office. However, once we launched public service announcements, we now receive 2,000 to 3,000 phone calls per week, and we have taken in over 40,000+ calls, and as well as double the email traffic, and just got an incredible team at the AG's office working on it every day. You mentioned the unemployment fraud scam. That's one that has just hit all over, including our governor, Asa Hutchinson. I don't know if you caught his briefing the other day where he had received notice that he had been denied for unemployment, which personally, I'm very glad that he is gainfully employed and healthy and doing an incredible job leading our state. what has happened and why people are receiving these notices is because of a data breach. There was a data breach where these con artists have hacked into the system, and now because individuals are no longer required to go in person and file for unemployment, they can do so online. So we have these cons that are filing for unemployment under your good name. So not only are they trying to steal taxpayer money, they're also trying to steal your identity. We are working closely with the Arkansas Department of Workforce Services to stop this fraud, to make people aware of this fraud, and to ensure that we are able, hopefully, to recoup some of this taxpayer money that's been stolen and out the door, but to really make sure that Arkansans' identity is not stolen in the process.
Well, and in the case of like my wife, she received something from 29 years ago. So when they steal that information, it could be from years ago and they're just sitting on the right opportunity to take advantage. If that was one thing I was told, as far as now with the pandemic going on, the strain on the system, that they are taking advantage of the opportunity before them. Is that a pretty accurate assessment of how it is that they're utilizing that information now?
Absolutely. Cons and criminals always take advantage and take opportunity of a bad situation to make it worse. And so we want people, if you have received a letter in the mail stating that you have applied for denied unemployment and you never applied for it, please contact us at the Attorney General's office so we can work with you and work with the Arkansas Department of Workforce Services to get this resolved. We have had, I believe, 37,000 to 40,000 individuals who have had their information stolen and fraudulent claims so that we're aware of at this time. An enormous amount of people, an enormous amount of taxpayer money. But again, we want to protect Arkansans and protect their identity from this. So give us a call at the Attorney General's office at 800-482-8982. That's 800-482-8982.
And I'll get Ben to post that up on the website so folks can get it if you're driving, didn't get a chance to write that down. 800-482-8982. Is that correct?
That's correct.
Okay. So, and part of the problem with that is people they actually have to get a police report if they've had their UI benefits compromised. That's one thing some folks may not realize. In order to be able to protect yourself down the road in case your credit gets damaged, you need to have that police report. Let's move on to another topic. What about the Jim Baker lawsuit that you're actively involved in?
Well, I'll tell you, Senator, if someone
If you
had
can
told
talk
me
about it.
25, sure, absolutely. If someone had told me 25 years ago that I would be suing renowned televangelist Jim Baker, I would have probably laughed at them. But unfortunately, that's exactly what we're having to do because Jim Baker was peddling colloidal silver, claiming that it was a cure for COVID-19. Unfortunately, there is no cure for COVID-19, and Mr. Baker, through his ministries, was selling this colloidal silver, again, claiming it was a cure for COVID-19, and which is in violation of the Arkansas Deceptive Trade Practices Act. And he was preying on the fears of Arkansans, of Americans, during this coronavirus pandemic that we are all in the middle of, and preying on people's fears and taking advantage of them. Arkansans spent and bought this snake oil from Jim Baker to the tune of $60,000 worth of it. And then Mr. Baker attempted to hide behind the pulpit and sued us, claiming that it was a religious liberty we were infringing on his congregation's religious liberty rights. And those who know me and my team know that there's no greater defender of our religious liberty rights. And what we were after was getting the information through discovery of who had actually purchased this so we could identify the Arkansans who had purchased this and to hold Jim Baker accountable for trying to take advantage and prey on Arkansans during this pandemic and any time, quite frankly.
Well, I can tell you as a minister myself, that's the last thing you really want to have associated with ministry is somebody doing that, because that puts a negative light on everybody because people automatically group us all together. So, I'm glad that you're going after him. It seems like Jim Baker is the gift that just keeps on giving sometimes. How far out is it that you would expect that to be resolved? And again, do you feel like you've reached all the Arkansans on that particular issue? Or are you still seeing some coming forward that, have been scammed?
Well, yeah, every time, yes. And so it depends on Mr. Baker and his attorneys whether or not they want to own up, if he wants to own up to what he had done wrong. At this point, we're not seeing that. So it will take a while for the investigation and to continue to get people. So, folks, if you purchased colloidal silver from Jim Baker Morningside Ministries, please let us know at the Attorney General's office so we can do the fighting for you, so we can recoup that money, because there sadly is no cure right now for COVID-19. And I wish there were, but and we all wish there was a cure for COVID-19. But Jim Baker is nothing more than a fraudster and a con trying to hide behind the pulpit, and we're just not going to let that happen.
All right. And scammers promoting a fake immunity boost for COVID-19, is that that's in the same category of what you were just talking about, but it's something different, isn't it?
Exactly. And it is, and it's we saw this prevalent in our Spanish-speaking communities. And so not only were these cons attempting to prey, and they were preying on the fears of Arkansans, but they were also taking advantage of folks who English is not their first language. And so there was somewhat of a language barrier, and they were selling this immunity boost. I'm putting my hands in little quotations in the air right now, this immunity boost, claiming it would prevent people from contracting COVID-19. Again, there is no such thing approved by the FDA. This is nothing more than another criminal and another con. And they were brazen enough to actually be going door to door peddling this nonsense. And they were selling it upwards of $3,000 a pop. Again, taking advantage of people's fears, taking advantage of a language barrier. And I want, we have numerous individuals, investigators, attorneys, others at our office, at the Attorney General's office, who are bilingual in English and Spanish, some other languages as well, but English and Spanish. And so please, if you know of someone who is English is not their first language, who has been taken advantage of, not just by this, but in any form or fashion, don't hesitate to contact us at the Attorney General's office. I'm not going to let language be a barrier to helping Arkansans.
All right. Any other particular hot spots as far as the fraud activities that you're dealing with, or any other in the top 10 list?
Well, there's always the robocalls where people are trying to take advantage of folks, and it's just important that Arkansans be aware that if someone calls claiming to be from any government entity stating that you need to make a payment over the phone, hang up. The IRS will not call you. Government entities will not call and threaten jail time if you don't make a payment. So please, Social Security fraud, they will not ask for your Social Security number. All of these things are red flags, and we have been working diligently to stop these robocalls, thanks to the help of Senator Hammer and others in our legislature for passing a stronger law here in Arkansas with regard to requiring phone companies to file with the Public Service Commission what they are doing to stop robocalls. It also raised the penalty from a misdemeanor to a felony if someone tricks the caller ID for nefarious purposes. And I've been working with attorneys general and the large telecom companies to try to stop this, and we've made great movement. Now you'll notice that many of the phones will say spam risk. But again, right now, the best thing to do is to educate people about these scams. The government is not going to call you and demand money. If someone calls and says they have a grandchild and it's a grandchild in jail, hang up the phone and call another family member. My favorite president, Ronald Reagan, says, trust but verify. And that's a great rule of thumb. If you are the trusting sort, it's okay to trust, but you need to verify the information.
I think that's one thing you could get a lot of legislative support from, because that's one of the bigger areas I always hear complaints about is the amount of robocalls, and it seems like each week it's going up. And so maybe we can talk offline about that. I got one other question for you. I'm going to let you go because I know you're on a tight time frame. Back on the unemployment insurance issue, that is something I'm about to have a congressman from Missouri on the line in just a minute, but that is actually an issue that is nationwide. So do we have the FBI and other federal agencies working on to track down the sources of this? And are we making any headway as far as finding out who's behind this so we can get this thing slowed down?
So, yes, we are working with federal authorities, local authorities on this investigation because of the wide breadth and scope of the criminal activity. And again, I encourage people, if you have received that notification that with regard to unemployment claim, and you did not file for unemployment, please contact my office at arkansasag.gov. That's arkansasag.gov. You can find us on Facebook, Twitter, Instagram, Pinterest, you name it. We're on it under Arkansas Attorney General Leslie Rutledge or Leslie Rutledge. Please find us and let us do the fighting for you.
All right. Attorney General Leslie Rutledge, thank you for taking some valuable time out on Saturday to spend on the Kim Hammer Show. I appreciate it. We'll get you back on to talk about some other subject matters and tell your husband hi and your beautiful child hi, and I hope you have a great rest of the weekend.
Thank you, Senator. God bless you, and you stay safe as well.
Thank you, ma'am. All right, next we're going to move on in the Kim Hammer Show to Congressman Blaine Luetkemeyer. I hope I've got that pronounced right. We'll find out here in just a second. He is a congressman from Missouri, the 3rd Congressional District of Missouri. One thing that I found impressive, if you've followed on my website, one thing I found impressive about the congressman is that in 2013, he was ranked Missouri's most effective lawmaker. The Legislative Effectiveness Project, run by professors at the University of Virginia and Vanderbilt University, measured how successful a given representative is in getting done. The average score of the members of Congress, this is an indictment, the average score of the members of Congress is 1.0, and Congressman Blaine Luetkemeyer received a 2.344. So I feel like we have a scholar and a gentleman and a great lawmaker on the line. And Congressman, thank you for taking time out on Saturday to be on the Kim Hammer Show here in the state of Arkansas.
Well, thank you, Kim. Great to be with you. And you've got a great senator there, or a congressman there as well in your area with French Hill. He's a dear friend of mine and does a fantastic job representing Arkansas and all the great interests that you have there in your state. So thank you for having me on today.
Well, thanks for coming on. I agree with you about Congressman Hill. He is. We're looking forward to sending him back up there after November to continue to do a great job representing us here in the 2nd Congressional District. Let me kind of get to the point. We'll have to take a break here in a second. But this past week, there was a video out where you were in a committee meeting, and as I interpreted it, you were calling into question or following the trail of money that is associated with COVID to providers for reimbursement. I just wonder if you could just kind of, expand on that a little bit and lay the groundwork, and if you don't mind, ask you a few questions about that.
Sure, absolutely. It started back at the first part of July. We had a hearing, and Admiral there, and he is a deputy secretary of HHS. And I asked the question of him then because I had heard anecdotally that there were a number of states that, a lot of people are misclassifying the deaths of individuals so that the hospitals can get reimbursed at a higher rate for them, even though they may not have died of COVID. So I asked the question of the Admiral, and he said, yes. He said, we understand that the states we have some states that are overestimating what the death rate is. In fact, his comment was that the CDC that gathers the statistics is completely dependent on the reports of local coroners. Yes, there appear to be some disincentives to overcode. And so what's happening is somebody can have a heart attack or be involved in a car accident. Autopsy would show that they had COVID in their system, so they would code it as a COVID death, even though the cause of death was a car accident, for instance. And you get the hospital then, if it's a Medicare patient, gets a 20% increase on the costs that they incur in taking care of that patient, that individual. And so we had this past week, a week ago, I guess 10 days ago, we had CDC Director Redfield in our hearing. And so I asked him, I said, Director Redfield, Admiral Grower was here a couple weeks ago and asked this question of him, and I asked of you. Do you see that there are some miscodings going on, and how alarmed are you about that? And his comment back to me was, and I quote, I think you're correct in that we've seen this in other disease processes too. Really, in the HIV epidemic, somebody may have a heart attack but also have HIV. The hospital would prefer the classification for HIV because it's a greater reimbursement. So I do think there's some reality to that. So, and we only get 5 minutes to ask questions, and as a result, most of my questions were at the end of my 5 minutes. And so the follow-up question should have been, okay, what are you going to do about it? And so what I've done is write a letter to both these individuals this past week now and request of them their actions that they're going to take to stop the nonsense and follow up, going to recover the money, or what are you going to be doing? Because the governor of Colorado, which is he's a huge liberal, but he even figured out that this was going on, and he did a review of his medical department, our health department did a review of their deaths that they had recorded, and found that about 12% of them were not COVID deaths, that they were, as I said earlier, things like heart attacks and auto accidents. Pennsylvania has done the same thing this past week. Texas also reviewed theirs. So there is beginning to be this understanding that there is a perverse incentive to get a 20% increase on the charges that Medicare will pay to the hospital for a COVID patient. So, to me, we've got, as someone who's supposed to be forcing the accountability of the bureaucracy for these dollars, I thought it was incumbent on me to follow up and continue on this journey here to see once what in the world is going on, what can we do to stop it, how prevalent is it, and see once where we can go with it. But initially, the money, the 20%, was there to help reimburse the hospitals for the services are much more expensive to give to a COVID patient than they are for a typical patient, and it was a fair payment to make. We don't argue about that, but I think whenever you have patients that are not dying of COVID, that you didn't treat for COVID, yet you're coding it that way, there's a perverse incentive for them to do this, number one. But, by doing this, you basically are trying to, misrepresent what's going on, and, you're gaming the system. So it's got to stop. Let me stop right there. I'll be glad to answer questions on it, but
you build a great front porch into a room full of questions. So, I hope your staff asked if you could stay on to one, and I appreciate if you can.
Yeah.
I'm going to need to take a break in just a second, but let me just kind of prime the pump a little bit for when we come back after the break. Last week I had Minnesota State Senator Dr. Scott Jensen on, and also had the president of the Arkansas Coroners Association on. And there seems to be, whether it's real, whether it's perceived or whether it's real, which I think we need to get to the bottom of it to see if it's real or not, about the miscoding of the deaths. I think here in the state, you mentioned 12%. I think here in the state, there's about a 7 to 8% of the total number being reported are actually underlying causes, not primary. So I'd kind of like to get into the conversation with you about the death, because death not only drives fear, but it also drives reimbursement. And I'm also going to ask you to think about, is there an effort, or would you consider an effort for congressional investigation into the deaths? I'm under the understanding that the White House has taken the death reports away from the CDC, and they are looking at them themselves, if you're able to talk about that. And then will providers, if there is an investigation and come back and find out that miscoding occurred, whether intentionally or unintentionally, will the federal government be looking to claw that money back from the providers and from the states as that all sorts out? And if you'll be thinking about those, we're going to come back after about a 2-minute break. And am I pronouncing your name correct? I've got Luetkemeyer. Am I pronouncing that correct?
Yeah, it's pretty close. It's Luetkemeyer.
Luetkemeyer. Okay. I'll work on that during the break. But we have Congressman Luetkemeyer on from Missouri. He is with the 3rd Congressional District out of Missouri. Kind of hit a nerve this week in a committee meeting, and we've got him on talking about COVID and reimbursement to providers. I want to thank our sponsors, which are Edwards Food Store, Central Arkansas and East Arkansas. Our premier sponsor for the week is Everett GMC Buick. If you're watching Facebook Live, there's all their contact information. You can order a vehicle from anywhere in the nation from Everett Buick GMC. And so I encourage you to take a look at them. And then also Baxley Penfield Mowdy. We're going to come back right after a 2-minute break, and we'll resume the Kim Hammer Show.
Take The Answer with you anywhere with our free mobile app. 1011 FM, TheAnswer.com, Amazon Alexa, iHeart, or radio.com. Breaking news and stimulating talk. 101.1 FM, The Answer.
Hey, are you guys open?
Yeah, we are. Come on in.
As businesses reopen across the nation, is your business prepared for what comes next? Salem Surround can help. COVID-19 brought America's thriving economy to a screeching halt. But now, local businesses are getting back to normal, and families are getting out to shops, stores, and restaurants. Are you ready for the return to business and all that pent-up consumer demand? Business Recovery Plan should be ready to go right now. The marketing team at Salem Surround is ready to help, so you don't waste a minute or a dollar recapturing market share. We'll help design your recovery plan targeting potential customers with proven marketing strategies. With everything in our toolkit working for you: digital, audio, mobile, even audience-engaging contests and promotions. Contact Salem Surround for a free evaluation of your digital marketing plan. Learn more at surroundlittlerock.com. surroundlittlerock.com, connecting you with new customers.
This is good news, maybe exactly when you need it to. Right now, MediShare is waiving their new member fees. This could save you money on top of all that you'll save each month by becoming a member of MediShare. So many people are looking for a healthcare solution right now, seeing the cost of COBRA plans, for instance, and MediShare is the affordable alternative to health insurance. The typical family saves $500 a month, but you might save even more. MediShare is a Christian community that shares each other's healthcare costs, and because of the current economic situation, they're making it easier than ever. Apply by July 31st, and you'll save an additional $170 on your first month. I'll give you the number here in a second, and if you call, you can get a price within 2 minutes. Just tell them the promo code SHARE to receive your additional savings. Maybe now is the time to make the switch, like more than 400,000 people already have, and start saving. Here it is, called 844-57-BIBLE. That's 844-57-BIBLE, 844-57-BIBLE.
All human life has intrinsic value, including life in the womb. That's why Focus on the Family is standing up to help the world see life. Join the movement to end abortion and love every heartbeat. Text heartbeat to 72,000. That's heartbeat to 72,000. And mark your calendars for September 26th to witness a transformational pro-life event we're calling See Life 2020. Learn more at focusonthefamily.com/see life.
Welcome back to the Kim Hammer Show here on 101.1 FM The Answer. Thank you for watching on Facebook Live. And again, our sponsors are Edwards Food Store, Central Arkansas, East Arkansas, a great place to go buy your groceries. You can order online, or you can go there and pick them up, and they'll take really good care of you. And the thing I always like about Edwards, any checkout you go to, you don't have to check yourself out. They'll check you out, so you're not paying somebody else, to do your job for you, kind of thing. Everett GMC Buick is a great place for you to find your GMC or Buick. And the one thing I wanted to re-mention was that for the 10th time, they were recognized as high honors. The only time in the dealership and in the GMC Buick line that a dealership has received that honor. So that tells you what kind of quality people you're dealing with down there at Everett GMC Buick. And then Baxley, Penfield, Mowdy, real estate in Central Arkansas for all your needs. They got a great commercial lineup of inventory, both for the residential side. And I tell you what, I know we're in a COVID situation, but I can tell you in certain areas, the housing market is popping. So it's a great time to list one, and it's a great time to buy one. Also remind you tomorrow at noon here on 101.1 FM The Answer, you can join us live tomorrow at 12 to hear the sermon that I'll be presenting to the church I pastor, Saline Baptist Church in Tull, or we'll be doing it Facebook Live when we get done with the Kim Hammer Show today. But right now, for the rest of the hour, I have Congressman Blaine Luetkemeyer, who is the congressman from Missouri of the 3rd Congressional District up there, and we are talking about COVID and reimbursement to providers. So when we dropped off, I gave you a list of things to consider commenting on. Let me ask you, first of all, about the possibility of congressional investigation into this matter so we can establish fact from fiction and conspiracy theory from reality.
Yeah, no, it's a great question, Kim. And what we're doing is the letters that I sent lay the groundwork. If you get exactly where CDC and HHS admit that there is, in their mind, a problem, and they are not doing something or they are doing something, then you know where to go from there. One of my colleagues is going to ask for a Government Accountability Office investigation, which is the next step. And then once we know what's going on and we see either the lack of action or minimal action, then we can take action ourselves and push to either have the government claw back this money or people go to jail or a combination of all that, depending on what we come back with, and see how extensive this is. So I think the first step is to get CDC and HHS on record and exactly where they are, what they know, and then what they're going to do about it. And from there, we can continue to build a case to try and take some action against either the individuals or entities that are gaming the system and claw that money back, or see once if there's other extenuating circumstances there that we're not aware of that allow them to continue to bill like that. So we want to build our case, and we're starting to do that as we speak.
So let me ask you, when you know, because some of the general attitude that floats around is that because this is a pandemic, worldwide event, and, you know, there's so much money being thrown at it, that when it comes to the actual auditing of the money that has been given to the states and to the provider, that because of the massiveness of the situation, that the likelihood of that is slim to none. Do you see that is going to be a reality, both for the auditing of the money that's coming down to the states and the care packages, but also that you would actually go back and claw money back from the providers, or would you be clawing also money back from the states, or would it be both?
Well, it's probably going to be both, I would imagine, although I think probably most of it would come back from the hospitals. I don't know exactly where the states would come in on this, but it's possible that would happen. Yeah, there is some oversight over a lot of the provisions. In the CARES Act, there were some oversight things that were created. One of them was a commission that your own Congressman French Hill sits on. So he's part of the oversight that is in place. But we also put in place some other mechanisms to oversee. I know the U.S. Treasurer, Secretary Mnuchin, is looking at doing a thorough review of the PPP program and some of these other loan programs that he really has oversight over. Some of the other dollars that are there in the program, different entities, are supposed to be providing some oversight over it. I sit on the Speaker's Select Coronavirus Committee, and that's the purpose of it is to try and do that same thing. Although, quite frankly, that's a political committee that she's put together to be able to hammer the administration for whatever actions they took or did not take, and rather than actually overseeing whether the dollars are being spent. And that's unfortunate because it could do a good job. But there are several other committees that are out there that have oversight over these different entities, different groups, and different piles of money that are out there. So we're going to try and watch it. Quite frankly, the PPP program, there was an article, well, I'm sure you saw that the numbers, there was like $280 million of money went out to different groups of people who probably should not have taken it, may or may not have been qualified for it. And that's a whole lot of money. But when you're looking at a $350 billion plan, that's an error ratio of about 0.10% So I don't know any public sector business that if they had a fudge factor of 0.10% wouldn't take that. But it is a huge amount of money, and the Secretary of Treasurer, as our Secretary of the Treasury, is clawing a lot of money back, and continue to watch anybody over a certain level of loan. They also are getting their file completely reviewed. So there's some review processes going on. I can't guarantee it's going to be 100%, but I think there's some watchdogs that are watching to make sure that this money doesn't get inappropriately spent.
Okay. I'm looking at the Becker's Healthcare Report. Are you familiar with that?
No.
Okay. It's the one that was put out that shows how much money each state receives per COVID patient, and it has the dollar amount attached to it. And when it comes to the money that's coming down to the providers, is what is the issue as far as you're concerned about it being too much paid, or because it's being coded as a COVID-related illness or a COVID-related death, or is it both of it because the money differs as far as whether it's associated with the death or whether it's just associated with the hospitalization where somebody recovers? Can you kind of drill down on that a little bit?
Sure. My concern basically is that you wind up with this extra 20% for a Medicare patient. And I've got some numbers here for you as an example. The Kaiser folks put together some studies and show that in 2017, the average respiratory infection was about a little over $13,000, where for a Medicare person with, say, 4 days on a ventilator, it was like $40,000. So, the charge then would be the 13 or the 40, and they would get an extra 20% on top of that, because if it was a COVID-related illness where they were in fact in the hospital because of COVID, they weren't in the hospital because of COVID. They had a heart condition, or they had diabetes, or the cancer, or something like that. That's what we're treating for. And incidentally, they had some COVIDs that they picked up somewhere along the way, but you were not treating them for them. Then you got a problem. But my big concern is that we're coding these things incorrectly just to make a quick 20%. And I think that's where I think we need to start. If we see there's an abuse on the rest of it that may lead there, I don't know. I haven't seen that yet, quite frankly. But I think if we're miscoding the deaths, that's an easy one to pick up. It's an easy one to correct. And even, you have some of these governors, the one in Colorado, you got Pennsylvania and Texas last week. They went back and reviewed their numbers and saw that there was inappropriate and incorrect coding of these deaths. So I think that's where we need to focus, quite frankly. I think that's where the abuse is. And there's a coding problem all the time between doctors and hospitals, anesthesiologists, nurses. I get into this debate all the time with the healthcare professionals and then the CMS folks at HHS, because the doctors and hospitals want to code something one way so they can get paid for it one way, and CMS says no, you need to code it this way because that's actually what the situation was. So I don't want to get into one of these back and forths on that. I think with the deaths of these individuals, we should know is either it's clear cut.
The stimulus package. You mind talking about that? I know it's heated up there. The president's talking about, executive order. Can you kind of give us an overview of it as?
I don't going to do anything with the package on August. The only part that may have something that they may get done would be the unemployment insurance. On this extra payment right now, the $600 payment that the Democrats want to continue to discuss it. It's their way of the highway. They have practically no alternatives to their initial HEROES Act numbers that is what they want to stay with, which makes no sense if you know how the process works. And Kim, I'm sure you do as a senator. You've got to find some middle ground somewhere, and they are not willing to even talk about it. So at this point, I don't see a whole lot getting done, even on that part of it. And I don't think the rest of it's going to have anything done at all until we get back in September, which, from the standpoint of where we are as a country, I think the $600 was a disincentive for a lot of people to work. I've had people, point blank to my face say, Blaine, as long as I get a $600 check a week, I'm not going back to work. That's $15 an hour. I can stay home and work and make $15 an hour staying home. So as a result, a lot of folks did not go back to work, and a lot of businesses were unable to hire people and open up completely. And so now, if people are forced to go back to work this past week, I think in the succeeding weeks here, I think you'll see an economic turnaround much more quickly than what we would have anticipated, because suddenly people, if they go back to work, you have to stop at the quick shop, get them a gallon of gas, get them a candy bar or some lunch you have to eat after a while. You'll see the businesses actually be able to do business now because they've got a full group of folks working for them. And I think you'll see by the 1st of September a completely different economic picture. But, if we keep this extra payment out there, it's going to be a disincentive for people to go back to work. The flip side of that is we also will know by that time which industries and which areas of the country, which group of employees are the ones that we really need to target for some additional help. If we find that at the end of 30 days here that there are certain industries that still are not up and running, and they're still struggling, or still closed, and we find that the employees of those folks need some help, we know where the help needs to be. And we can still go back and still issue a $1,200 check, which the president wants to do, and we can still go back and do another check if that's what everybody wants to do. But I think it would be very targeted, be much less expensive, and I think I think we'll see the economy will be rebounding at that point pretty significantly. Again, our numbers this week came back from July, continue to see improvement in the economy, and so I think it's going to continue to do that as we learn to manage this disease and learn to get our businesses open.
Well, I know I have some employers that, have reached out to me, and one of them in particular, which they're in the service industry, their employers kind of packed up, or employees packed up on them, and they came to him and said, well, I'll tell you what, we need a raise equivalent to what it would cost us to be able to stay, or what we would be able to get if we stay home. Just as a state lawmaker, I'd be fine if that $600 went down or went away. And if we were able to, get people reengaged into the employment. I do understand that there are individuals out there that are legitimately suffering because, their facilities or factories have shut down. But, also I've heard a lot from the employers that are saying what a difficult time they're having getting people to come back to work because you get paid more to stay at home.
Well, Kim, there are also some folks that are gaming the system here. I'm not sure if you're familiar with it, but what's going on is some employers will work their employees 4 days, furlough them the fifth day, which qualifies them for the $600 payment. And there's actually some state and local governments that are doing the same thing. So, I don't begrudge the $600 payment to folks if you're truly in dire straits and you need that to make ends meet. But when you got the system out there being gamed and you got people staying at home, because you're working every day and you're paying for these folks to stay home and not work by you going to work. And so I think, I've got a perfect example. I got a guy that's a contractor, lives down the street from about 5 houses, and one of his crews is his bricklaying crew. Now, his bricklaying crew, those guys make pretty good money, but they can stay home and make an extra $600 a week and draw unemployment, and they're not going to work. And he said, Blaine, cut that nonsense out. I need my bricklaying crew back so I can go back and finish up some construction projects. I mean, it's like that across the board, and I'm sure you've heard that if you just said, Kim, that as well. That we've got to get people back to work, and this is a disincentive to work. I've actually asked a question in committee of some of the healthcare professionals when they're sitting there and talking about, they can't do this, can't do that. I said, well, tell me how would you incentivize people to go back to work? I said, you're sitting there trying to explain to me why we need to be paying them not to work. I want you to tell me how we should incentivize them to go to work. Crickets. Never get a good answer from anybody. They just sit there and mumble around. Well, hum, hum, hum. It's amazing. The witnesses are always all about one thing, and that's to try and make sure they give away as much government money as they can, rather than incentivize people to go to work and help themselves. And so it's very disingenuous of them to have those kind of arguments out there that they're making, and it really shows up when you ask a question like that.
Well, and I sympathize with you guys that are at the federal level as far as serving as senators and representatives, because the environment that you've got to serve in up there, I cannot begin to imagine what it's like. We're pretty blessed here in Arkansas, even though we have our differences. We still figure out how to get it done, but you guys just seem to hit your head against the wall sometimes when you're dealing with the Democrats and, the environment of the difference of wanting to give everything away versus just, conservative values. So I commend you for, serving as long as you've served up there. Let me ask you a question.
Well, I tell you, you probably need to get your congressman there, Mr. Hill, buy him a drink next time you see him, because he has, he and I serve on the same committee. We've got Maxine Waters as our committee chairman, and we've got AOC, Talib, and Presley, 3 of the 4 squad members on our financial service committee as well. It is a bang your head against the wall day every day in committee.
Well,
it's amazing.
But we can't quit, can we? Because if we quit, they for sure win. So, hey,
that's exactly right.
Let me back up and ask you about something. The previous money that came down to the states in the first stimulus package, the money that was given to the states, how strict of guidelines are there attached to how that money is spent? And I'm not talking about to providers. I'm just talking, the block grant, as I would call it, that was given to the state, and, go forth and spend. As far as what y'all are going to be looking at as coming back and looking at how the states actually spent their money, because some states are spending it faster than others. Some seem to be holding it back because they're a little concerned about what might happen after they spend it if you come back in a year or two and say, no, you shouldn't have spent it that way. because it's been a little bit of a lag time coming down from the feds to the states as far as what can be done or not. Could you speak or enlighten us on that?
Sure. No, it's a great question. I know that a lot of states have got a lot of money sitting in their accounts yet they haven't used or spent. And technically, it's supposed to be for COVID-related expenses. And part of it also that goes back to the local folks, to your local counties. I think we kind of screwed up when we did this. We made it so that you had to have, I think, a county of 500,000 people or more. So basically, you took care of your big cities and your big counties like that, and those smaller counties, which have some needs as well, although obviously not as much as your bigger cities, didn't qualify. And so it's very difficult to get them the kind of money that the bigger cities are getting for some a little more broader scope of things that they can get paid for. But I think what we need to do is go back and probably change some of the criteria or make the payments a little more flexible so that those certain areas of your state could be helped by this. I know you're right when you say that some of them are a little reluctant to spend it because they're fearful if they spend the wrong thing and they're going to wind up having to foot the bill themselves. And they should be concerned because the criteria are very specific at this point about what they can and cannot do. But maybe we need to loosen it up a little bit so that they can be able to address some of those needs a little bit differently, a little bit better. That being said, some of the states want to use this money to plug a hole in their budget. Some of them want to use it to plug a hole in their retirement systems, and that's not the purpose of it. The purpose of it was to try and help the states and local governments get through this crisis and pay for their COVID expenses, which are things that, through no fault of their own, through no problems with but you, Senator, did not cause a problem with the way you budgeted money at your state level. This is something that's outside your control, and we want to be helpful with. That being said, some states have got themselves in a corner, and they want to use this money for all sorts of other things other than COVID expenses, and that's where we kind of have a run-in. So we'll see how it plays out. That's a big discussion that's going on right now on what we should be doing or can be doing with those extra dollars that are not being spent, and are they really should they be purposed, or should the criteria be loosened up, or how should we approach it? And that's a discussion that's ongoing right now.
Do you know if they will extend the date? Because I know the money had to be spent by the end of the year. If states are sitting there and they do not have all the money spent, do you know if it is a realistic expectation that the date would be extended to next year, that this first batch of money that came down, states could have that long to spend it, or is there any conversation around that?
Well, I think that's part of the discussion as well. As we continue to see that this pandemic continues to drag on and on and on, and some states have a second wave or now are getting their first wave. We may need to take a look at that. That's part of the discussion about timing on it as well. It's a great question, but at this point we don't have a hard answer. But I think it's something that we're going to look at and see if that's also a possibility in a way to be helpful to both the state and local governments as well.
Do you have any anticipated time when that decision might be made? Would it be released at the same time the next batch of money might be coming out, or do you think it'll be later on?
No, that's a great question. Well, I think that's when it will occur. Whenever we get this second stimulus package or CARES Act 2.0, whatever you want to call it, I think that's whenever we'll find that we'll package some of these things. We'll do the same thing with the PPP program. We'll probably either put some more money with that and then change some of the criteria so that there is the ability of some business to get a second loan if you're continuing to struggle. And the same thing would be for the states and the local governments as well. That will all be, I would think, in the same package. And that's because there doesn't seem to be a desire to break those things up into separate little pieces. Most of the folks want to have it all in one package so it all works together and can get things done like that. Otherwise, each package will get nitpicked apart as it goes through the process, as you well know.
Okay. And I guess one thing I should have said for the listening audience, because you are speaking as an expert, and the reason that you are is because you're on the House Select Committee on the coronavirus crisis. So you're right there in the thick of it, if I'm interpreting what your committee assignment is. Is that a fair statement?
Yeah, it's the Speaker's committee, and as I said earlier, it's kind of a redundant committee because we have several other oversight committees, but it is There's 12 of us on there, 5 Republicans and 7 Democrats, and we meet about once a week, once every 2 weeks, and go over whatever issue we need to be discussing. This past week, we had the issue was whether we should be opening schools or not. The previous week, it was with regards to the other data. We had Dr. Fauci and Dr. Redfield in front of us, as well as Admiral Gore, and talked about all the other things that those guys oversee and those kind of activities. So that's kind of what we're doing. But yeah, it's an interesting committee from the standpoint I get tons and tons of studies and surveys and videos and testimonials and all sorts of speeches that all sorts of different doctors and think tanks from around the country put together. And just got a stack of information here that it's interesting because a lot of it is stuff that's out there that people are talking about from the standpoint of what's going on, but it's not being reported by the media, which is very unfortunate because a lot of it really contradicts what the media is saying and would give the people a whole different perspective on this whole coronavirus situation if they had the correct information. But the media is kind of keeping it from some of the folks and not talking about it. And I'll give you one quick example and then I'll move on here. But the University of Pittsburgh Medical Center about 2 months ago, and this is a center where these folks did some initial vaccine studies on polio. This is where that vaccine was developed. So these folks are not some pikers. They actually know what they're doing. And they said, look, we see that the virus is actually mutating to a less potent strain. In the same article that they were talking, there's 2 doctors in Italy in 2 separate regions of Italy made the comment that they see the same thing happening there. And anecdotally, New York is also saying that the virus appears to be mutating to a less virulent strain. And you stop and think about it, the stronger the virus, it gets into a host and kills it. That virus dies with the host. So therefore, a lot of your stronger viruses are actually being killed off as they kill off the host. So it would make sense that the thing is mutating, but you don't hear that from anybody. Nobody's talking about it. So it's interesting to see that some information is out there. We keep talking about the increased cases that our testing reveals, yet you don't talk about the percentage of hospitalizations that are either steady or going down in most cases, and the percentage of deaths continues to go down dramatically, and why. And so nobody talks about why those deaths are going down because of the drugs, the way they're being administered, the new procedures, new therapies they've got in place. It's very frustrating to see that the American people don't see these things. And if they would, they realize that this is not the plague. It's something that we can deal with, we can manage. And it's unfortunate because the media, quite frankly, in my opinion, just scaring the heck out of folks and getting away with it. But, the way it works.
I tell you what, I always want to leave people wishing we had more time, and I think we've done that today. Might get you back on if you could graciously allow me that opportunity because of your position as a committee member up there. And I very much appreciate Congressman Blaine Luetkemeyer from Missouri, 3rd Congressional District up in Missouri being on the show today. And I'll be back in touch with you and communicate more and see about trying to get you back on. I want to thank my sponsors today, Edwards Food Stores in Central Arkansas and East Arkansas, Everett GMC Buick down in Saline County, and take a look at the sign, and then Baxley, Penfield, Mounty. Thanks for listening to Kim Hammer Show.
101.1 FM, The Answer. KDXE FM, Kamak Village, Little Rock, a Salem Media Group station. 101.1 FM, The Answer.